Like it or not, political mudslinging gets heavy around election time, and people come up with all flavors of insults. These aren't always representative of a person's actual character or actions, and we think that's especially true for one we've heard this year. Today we're talking about menstruation and period poverty, and why the derisive nickname Tampon Tim isn't actually any insult at all. That's the topic of this week's Healthcare Triage. If there were something we could easily implement to reduce school absences and dropouts, boost student confidence and mental health, and positively affect their long-term economic outlook, would we do it? The good news is that this something exists. The bad news is that a fair number of people are unwilling to implement it. So what is it? Period products, which can easily be provided in schools alongside other hygiene necessities like soap and toilet paper. Interestingly, many people's gut reaction to this is negative. Menstruation suffers from social stigma, and inequitable management of it is perceived as an unfortunate reality of life. But we and many others disagree. In a 2023 TikTok, Idaho State Representative Rod Furness can be seen in a House debate over period product legislation explaining the 2 P's of hygiene and the role of the government in addressing those. Then going on to say that, surprise, the girls have 3 P's. Nearly any restroom in schools or public places has items like toilet paper and soap. These things are really great for hygiene, and a lot of us would be horrified to get caught without them, which is exactly the situation many women and girls are finding themselves in once a month. Period poverty is the term for being unable to afford sanitary products related to menstruation, so things like pads, tampons, or menstrual cups, and or lacking access to adequate facilities for menstrual hygiene. Around the world, at least 500 million girls are unable to access the facilities and products needed to manage their periods. In rural Uganda, almost 2/3 of girls miss school at least once per month due to their periods. Around 46% of girls in India and more than half of girls in Ethiopia are absent from school during their periods, which is 5 times more likely for girls that do not have access to period products. A large portion of these absences are associated with factors like social stigma and the lack of proper facilities, failing to provide girls with adequate privacy, water, and sanitation needs. But even in countries where access to these things is the norm, period poverty remains. 1 in 5 American girls have skipped out on a school day early, or skipped it altogether because they were on their period and were unable to access the menstrual products needed to deal with it. This is especially true for low-income students, whose families may not have the budget to include period products in their grocery list. In the 2023 State of the Period report, and yes, that's a thing, the results from a survey of nearly 2,100 individuals in the United States found that nearly 1 in 4 teenagers and 1 in 3 adults struggle to afford menstrual products. Also, according to this report, nearly 45% of teens feel stress and embarrassment related to lack of period products, and 40% of teens reported wearing period products longer than recommended, which can lead to serious issues like urinary tract infections and toxic shock syndrome. A 2021 study estimated that over 14% of women attending college in the United States struggled to afford menstrual products, and that this lack of resources was associated with worse mental health outcomes. Our writer here at Healthcare Triage, the only woman on our team, can assure you that a good deal of anxiety accompanies a situation where your period starts in a public place and you don't have what you need to deal with it. And unfortunately, this isn't just a problem for people in school. A number of adults struggle to afford menstrual products as well, and it affects their ability to show up for work and attend to other major responsibilities. A 2019 analysis of menstrual hygiene needs among low-income adult women in Missouri revealed that nearly 65% of the women were unable to afford necessary period supplies in the prior year, with over 20% of them struggling to afford needed supplies every month. So what can we do? We can support initiatives like the Period Project and the Alliance for Period Supplies, nonprofits working to end period poverty. We can also support legislation that requires these products be provided in schools. Legislation like the one signed in Minnesota last year that requires public schools to provide period products to 4th through 12th graders. That one, as many of you know, was signed by Tim Walz, the governor of Minnesota and candidate for vice president in 2024. So to bring the story full circle, Tampon Tim just isn't the insult it was meant to be. Ensuring that everyone has access to everything they need in the bathroom is just a pretty decent and easy thing to do. Hey, did you enjoy this episode? You might enjoy this previous episode on another healthcare issue for women, contraception. We'd appreciate it if you'd like this video, subscribe to the channel down below, and perhaps go to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Edward Liljeholm and Joshua Crow, and of course, our Surgeon Admiral, Sam.